Hi, everybody, and welcome back to another episode talking all about fibroids with myself, Dr. Maryellen. We have Dr. Molly Sears and Dr. Shreya Soni as well. So if you have not heard about fibroids before, they are actually non-cancerous tumors that are found in the uterus. They range in size. They can be as small as a pea, or they can get as large as a watermelon in some cases. Actually, they are quite common. So up to 70 to 80% of women may develop a uterine fibroid in their lifetime. However, most of these women may not actually experience any symptoms or need to be treated. Symptoms to watch for, so if you do have fibroids in your uterus, would be heavy and prolonged periods, bleeding between your periods, or pelvic pain. It's important to note that if any of these symptoms are really bothersome, if you have pain that doesn't go away, if you're struggling with anemia or low iron, or if you have bleeding that does not stop or is prolonged for a while, it's important to seek medical care and tell your doctor about it.
Risk factors for fibroids include estrogen dominance. This is when your body is producing more estrogen relative to progesterone. This can happen if you didn't have an ovulation that cycle, so someone with PCOS, if you've been ignoring the fact that you have heavy periods for many, many years, or if you have short cycles. All of those are signs that you may be dealing with estrogen dominance. And the short cycle would be a cycle that is, for example, 20 days long. Oxidative stress is another risk factor and cause for fibroids. Oxidative stress basically means your body is being exposed to some pollution and your liver is having to work harder to detoxify. So types of pollution could be smoking, air pollution from living in the city or around fires. Here in California, we've all been exposed to a lot of oxidative stress this year with the wildfires. Vitamin deficiency can be another risk factor, making you prone to fibroids. Vitamin D deficiency is a huge pandemic at the moment. Almost most people I test are deficient in vitamin D, so it's important to know your nutrient levels. Other vitamin deficiencies that can contribute to fibroids would be iron. Vitamin A is another important consideration. Environmental toxin exposure, similar to the discussion about oxidative stress. Exposure to plastics in your environment like xenoestrogens. So plastics contain chemicals like PCBs. There can be phthalates and parabens in your cleaning supplies or shampoos or conditioners you use. All of those toxins do put a toll on your liver, especially if they go in through the skin, they go right into the bloodstream, and they can mimic estrogen in your body and then cause symptoms of estrogen dominance like the growth of fibroids. So your liver needs extra love if you're exposed to environmental toxins. And best thing you can do is get them out of your environment. So start to pick clean products. Perimenopause is another time that risk for fibroids increases because women may have anovulatory cycles. So for example, a cycle where they don't ovulate and there's a surge of estrogen and not the progesterone to balance it out. And so it can feed fibroids more. There's that risk during that time. And then race can also put you at a higher risk for fibroids. Unfortunately for Black women, there's a 2 to 3 times higher rate of incidence of fibroids.
Nice. So now we're going to talk about treatments. Like Dr. Shreya was talking about is that estrogen progesterone balance. And so one way we can support that is by supporting estrogen clearance. Again, we're targeting the liver when it comes to this, as well as our gut health. We're looking at eating more cruciferous veggies, intake of water increasing, looking to get more phytoestrogens in our diet. So maybe some ground flaxseed, and then adding fiber. And then just as important as it is to include those things, we also want to avoid, processed foods, saturated fats, sugar, caffeine. All of these things can be inflammatory, but they can also affect the B vitamin status in our body, which we ultimately need to support estrogen clearance. Then we're looking at using blood-building nutrients. So in traditional Chinese medicine, we look to dried fruits, specifically dates, and goji berries can be good as well to try to rebuild some of that nutrient loss. And then nettle is a plant, and you can make nettle tea. You can, soak nettle in water overnight. You can get nettle in tincture. That's going to help that iron status as well. And then when you're dealing with fibroids, again, you're going to be experiencing likely heavy bleeding. So using things to slow down that bleeding. So vitamin C and ginger have some research to support supporting the vessel strength. And then using blends of herbs. So there's a really popular one called Slow Flow, as well as others. And you'd want to work with a healthcare practitioner if you're going to be taking those. Getting your iron checked. So looking into your ferritin and your hemoglobin and making sure that you are at a safe level to, maintain yourself. Sometimes it's necessary to get an iron transfusion. And then ultimately, if it's a fast growing fibroid or it's causing you severe symptoms, surgery can be done to remove some fibroids.
Yeah,
Do you guys have anything to add?
it's important to get the fibroids checked. So the way you'd get it checked is with a transvaginal ultrasound, and then your doctor might need to biopsy if they find something suspicious. Fibroids can be in any layer of the uterine muscle, but definitely if you're dealing with heavy periods, don't ignore it. Talk to your doctor and get some help, because you could prevent some of the long-term consequences of estrogen dominance and some of the risk factors associated with fibroids, which is uterine cancer. So you do want to avoid those cancers associated with estrogen dominance by dealing with the cause of fibroids.
Yeah. And if you catch it earlier and you do need surgery, you're better off getting it removed earlier, because you don't want it to grow so much that they need to remove perhaps like your entire uterus. So, getting it removed when it's smaller is better.
Exactly. And being proactive. So if you are someone who menstruates, making sure that getting those yearly labs and checking in on ferritin, your iron storage, your CBC. So looking at those red blood cells, your hemoglobin is super important. So I'll share a case study. I had a woman in my practice who, for the past year, we've been working on trying to get her iron levels up, and it was a vicious cycle of heavy periods and low iron. So we decided to do some further digging and get some imaging done. And on a transvaginal ultrasound, it was found that she did have some fibroids in her uterus. So that did definitely change our treatment plan, and happy to report that now iron is coming up and bleeding has stopped, and she's doing really well with that.
Yeah, and I wanted to share some cases too. I've had patients who've had fibroids come in to see me, and then every year we get them checked, and some of them do get smaller with the naturopathic approach. I have seen them getting smaller over time.
Awesome. So if you guys want to reach out, these are our social media @. And I'm practicing currently in Colorado, Dr. Soni's in California, and Dr. Maryellen is in Ontario.